All right, welcome to another Zoom call. Reminder, as I do every week, if you have questions that you want answered right away, look at our blog post on our regular website. So I'll have a ton of stuff in our new membership site, and if you're not utilizing that, you're making a mistake. That's where we're going to have all our announcements. So I'll make announcements on the weekly Zoom calls, but they're also posted on the main page, the home page of the patient membership site. So make sure you look at that. If you say, well, I don't even know what that is, you have been sent, if you're a patient of ours, you have been sent an invite. So search your email that you use with the clinic for either info@connersclinic.com or memberships or something like that. And you should find that invite, and you need to create a password. Your username will be your email, your main email. Your password is something you create. If you forget your password, you can just ask it for a new password. But you should be using the membership site. The membership site is where you're going to see announcements. So I will make announcements as new things come up on our Zoom calls, which I'm going to do right now. So number one, use the members only site to see all announcements, please. Number two, we added a new Zoom call on Mondays at noon with Ann. Next week will be her first one. See details on the members only site. It's just a Q&A Zoom call with Ann on Mondays at noon. That's Central Time. All the details are on the members only site. You do need to register for that, just like you registered for this one. Then you'll get email reminders every Monday or whatever Zoom sends out the reminders. And you'll get the login details. So look at the member site for that new information. We don't have a submit questions for Ann form yet. That's something we're deciding whether we're going to add or not. We also added a page on genetic reviews. We are now doing all these via Zoom call on Thursdays at 2. So if you did not have your genetic review yet, don't worry. Just wait until we tell you that your genetic information is back. So don't jump on this Zoom call next Thursday at 2. She's not doing it tomorrow. I think it's going to be next Thursday, the first one. Do not jump on it until you get your genetics back. Otherwise, she'll ask you just to jump off. So, and then lastly, there will be no Zoom call next week. I'm going to take a few days off. And there will be no Zoom call next week. This will be the first Zoom call that we missed. I think I missed 4 Zoom calls in 5 years doing this. And I decided I'm going to take next week off. So apologize for that. You can still send your questions in, and the week after ends up going long, and it will go long. A lot of questions came in, so let's get started. Sorry, I think this was addressed in past Zoom calls, but I cannot find it. I am avoiding all sugars and sweeteners. My plan also says to avoid sugars. Are xylitol and stevia considered generally included in the sugars to avoid list? Good question. We haven't had this for a while, so that's why you probably haven't seen it in any recent past Zoom call. Xylitol is a sugar alcohol. There's lots of different sugar alcohols on the market. Now, xylitol would be considered safe for people trying to avoid sugar. It does not increase your blood glucose levels. So that's the whole idea of avoiding sugars and sweeteners. You don't want to increase your blood glucose levels. The xylitol that you do want to look for, though, you want to look for a good organic xylitol. A lot of xylitols are made from GMO corn now, and you don't want that if at all possible. Stevia is also a safe sweetener that's made from the stevia plant. You can grow it yourself if you want. That you also don't want any major name brand stevia, probably because it's made from GMO, or there's usually pesticides and junk like that on it. So get a natural, as natural as possible products that you're sourcing for these. Avoiding kale is a common question because I've said it in my book, I've said it in different things that we don't want to have a lot of kale. So both greens drinks have kale listed as ingredients. Chocolate flavor has a little bit less maybe. Listing is last. I think it probably has the same amount. Plan says to avoid chocolate, which is worse, chocolate with less kale or no chocolate with no kale. So where you want to avoid kale, I think I touched on this last week or the week before too. Why would a person who has cancer want to avoid kale? Well, you want to avoid boosting nitric oxide levels. So nitric oxide is something that is really good to boost if you have cardiac problems. So if a person has cancer and cardiac problems, kind of in a catch-22. So why wouldn't you boost nitric oxide if you have cancer versus cardiac problems? Well, nitric oxide does a couple things. It can decrease inflammation at the endothelial level in the subendothelial muscle. So your endothelial are your single cell epithelial cells that line all your vessels. So nitric oxide can be very beneficial as a relaxant to those muscles, so it can decrease blood pressure. It also, because it opens up your blood vessels, it can be beneficial for electrile ED as well for men. But for cancer patients, it also increases vascular endothelial growth factor. So it can increase growth factor of vessels, which is really good for a heart patient, for a cardio patient, but it's not so really good for a cancer patient because we don't want to increase growth, blood vessel growth into cancer. So this would not be applicable to blood cancers like leukemias, multiple myeloma. Still would be applicable to lymphomas, but it's mainly for solid tumors that I'm speaking about here. So avoiding too much nitric oxide. Now, having a little kale in your salad, having a little kale in your green drinks is just fine. So that's why we use the greens drinks. A little bit of kale mixed with other things just fine. It's just that why I put that in my book and why I have a video stated on a video is because a number of years ago was a really big craze, maybe it still is, to make kale smoothies. So people are just stuffing kale into a blender and blending it up and just continue to do that, or juicing kale, because that was very good for cardiac problems. But it's not having such high concentrations of kale. Kale is the highest concentration of naturally occurring nitric oxide is found in kale. And then it has more than 3 times the amount of nitric oxide in the same weight of spinach. That's, I think, the second most. It's just, you wouldn't want to make a kale smoothie with a ton of kale. It's probably too much nitric oxide, but having a little bit of kale in your salad every day, having a little bit of kale in your green drink, you're just fine. You just don't want to overdo kale like like some groups of natural people did in the past, at least. Like I said, it was a big craze for a while doing kale smoothies. So that's why I talked about kale. But having a little bit in your greens is just fine. That's not the issue. FYI, I found that there's a RIFE program for neuropathy in case this helps anybody. Fantastic. That's great. Hopefully that will help some people. There's also some neurological programs. I can't remember the name of it because I just looked at it today. But there's a neuro program, neuroregeneration, I think it's called. That would be helpful, I think, too. Is there a phosphatidylcholine supplement that is not derived from soy that you could recommend? The alternative that our store has been out of stock for quite some time. Yes, there is, I think it's phase two. Look it up real quick here. I think it's the phase 2.5 supplement that has phosphatidylcholine from uh, another source. I think it is, let's see, it's yes, that's phosphatidylcholine from sunflower lecithin. That's in a capsule form. So it's phase 2.5. Um, that is, I'll show you this product right here. Phase 2.5 bile support. That has phosphatidylcholine that is not derived from soy. That might be your best bet. Some of our products, if you do notice a product on our store that says sold out, make sure you call the clinic and talk to somebody in the store. Sometimes it's listed as sold out because we just can't get it anymore, or the company discontinued it. And in order to, our web person said, don't take it off because it's not good for the store. So make sure you ask about that. And some things are just on back order. You have one thing that's on back order until October. It's just crazy, some of the things. There's one product from one company that we don't use a lot for cancer, but that's been back ordered since last November. It's still not out. I recently heard the term ferroptosis, which I understand is a non-apoptotic form of cell death. To my understanding, it is an apoptotic form of cell death. It's not a uh, it's not a normal apoptotic form of cell death, though. I don't know a lot about ferroptosis. It's, I think, generally considered a pathological death of a cell, though it does go through apoptosis, but with some different type of blebbing that's different from normal apoptosis, has something to do with different oxidation of the cells in different ways. I have not heard it to be used as a treatment for cancer, though, so this is interesting. I'm going to have to dig into this. Can you please explain this process and the relationship to other forms of cell death? Well, I can't explain that process. I don't know enough about it yet. I'll have to dig into it and learn a little bit about it. Is one better than the other? So normal programmed cell death is called apoptosis. There's multiple different stimulation of apoptosis that takes place. I actually have to get back to it. I created a whole PowerPoint presentation on it, and then I didn't end up recording it because it was just so technical and deep that I thought, oh my gosh, nobody's going to want to listen to this. It's a couple of years ago, and I saw it about a month ago. I thought, oh, maybe I should re-record this. So I'll have to look into it. There's different stimulations of apoptosis. How apoptosis is normally stimulated from an external environment, meaning external to the cell. There's different receptors on your cell membrane that are apoptotic receptors that also function in different ways. The vitamin D receptor is also an apoptotic receptor. That's why vitamin D can be good for cancer. This is the different apoptotic receptors are what can be blocked by bad estrogens, and estrogen in ER positive, PR positive, and HER2 positive cancers. It's not that the estrogen is the cause of a cancer ever. What causes a cancer is something that got inside the cell that affects the replication cycle. That's not what estrogen does. So when a person has ER positive cancer, that isn't, the estrogen is not the cause of the cancer, but estrogen, and it's only the bad estrogen, quote unquote, that gets that attaches to an apoptotic receptor, and those are called the estrogen beta receptors, or the AL receptors they used to be called. And when it attaches to that receptor, it blocks apoptosis, so apoptosis doesn't take place. So the idea of removing all estrogens, because they have a drug for it, is you're also removing those quote unquote bad estrogens, and then you are opening up that receptor for apoptosis to take place normally. It isn't in itself a treatment for cancer, but it helps induce apoptosis or help block the blockage of apoptosis. That makes sense. I also read that there are maybe repurposed drugs that can induce ferroptosis. I don't know what those are. They may be found at Care Oncology's site, and that gal's work on different reuse and repurposing of different drugs. You may find more information there at Care Oncology. My acupuncturist, who also does IV therapy, mentioned that sodium ascorbate as an alternative to glucose-derived high-dose vitamin C, so they can be used for IV therapies. Do you know much about this alternative? Not a lot. I do know that it's still synthetic, though it may not be glucose-derived. I don't know if glucose-derived ascorbic acid actually does anything to glucose, though. Just because it's derived from glucose doesn't necessarily mean that it's raising glucose levels in any way. It's certainly easy enough to check by just checking your glucose levels. I don't believe that that takes place. The problem that we have posed, the possible problem we posed about IV vitamin C in the past is that it's synthetic and it's simply ascorbic acid. Well, sodium ascorbate is just another form of ascorbic acid, so that's not really a solve to that problem. Can't get whole food vitamin C in an IV form, and that will probably never be possible. Also, someone who's avoiding any type of glucose-derived high-dose C and looking for additional functional support for neuropathy, would you recommend any other supportive IV therapies without C, such as B vitamins? Well, the B vitamins that are given in IV centers are all synthetic too. And that's a concern of mine as well. I think actually the B12 is cyanocobalamin, which is not really good at all. And they may have a hydroxycobalamin, which would be good. If they're using a methylcobalamin, this is the B12. So cobalamin is B12, it's linked to something. If it's linked to a cyano molecule, then that's highly synthetic and not recommended. If it's linked to a methyl group, that's what's typically recommended for non-cancer patients, because methyl groups can be, people can have deficiencies in methyl groups, and when the MTHFR genetic SNP defect was discovered, that was a piece of the genetic complex that takes folate to end up making your B vitamins and methyl groups through the whole methionine cycle. So everybody was hot to trot on adding methyl groups to their vitamin B. So they changed all their vitamin B complexes to methyl tetrahydrofolate for the folic acid. Well, it's much better than folic acid. Folic acid is a synthetic folate. And they changed their B12 to methylcobalamin versus cyanocobalamin or hydroxycobalamin or adenosylcobalamin. Now that's all good and great, because if people have a MTHFR defect, they need more methyl groups, but it's not so good and great because as you learn more about genetics, you learn that too much methyl groups, even for someone who doesn't have cancer, drives other pathways. And one of the pathways that too much methyl groups drives is the biopterin pathway, where you make all your neurotransmitters. So people can, and if you have any type of mood disorders at all, which how many people have that today, with anxiety or depression or OCD or all sorts of different things that everybody probably has some form of that. Two excess methyl groups can drive that pathway, and you can get a surge of serotonin and have rage issues and anger issues, or a surge of dopamine and have different issues, or glutamates and have OCD issues. And there's just a lot of different issues with that. So I've never been a fan. As you learn more about genetics, you don't just look at one gene defect to treat the person, because you can cause them more problems than not. So, and then it further gets complicated when you have a diagnosis of cancer, because one of the things methyl groups do is they silence genes, and we want to be careful with excess methyl groups. We don't want to silence our tumor suppressor genes. Long story to say, I'm not a big fan of IV B vitamins. Magnesium is probably fine to have in that, but magnesium is fairly readily absorbed, so I don't know why you'd want to get it in an IV. Cost of doing an IV and getting magnesium, unless you're completely dehydrated and your electrolytes are so off that you need some minerals. I don't see any sense in that. Calcium, there's no way I would get calcium in an IV. Most likely it's a calcium carbonate, and that could cause vessel hardening. That in itself could cause cardio issues. There's no way. And people, cancer patients are not typically deficient in calcium. More so if they have metastasis, they have excess calcium in their blood. And if your calcium levels are normal and you're adding calcium via IV, you're literally throwing off your pH of your body, and your body has to deal with that with a whole bunch of different buffering systems taking place. So I would never do calcium in an IV. Amino acids, again, amino acids are typically very readily absorbed, and in forms that you would normally receive them in plant-based amino acids, much more than an IV. Besides the fact that some cancers can be driven by amino acids, so I'd be very careful with that. Regarding parasites, I'm still passing many worms a day. I'm assuming they are passing because their ecosystem is becoming unhospitable to them. So you're getting healthy and they don't like living there. Or is it something I'm taking? Well, probably is something you're doing. It's just you're changing your gut, and you're changing your body, and you're helping make them not happy there. Coffee enemas can help very much. Rife for, if you're running parasite programs, that is the best killer of biotoxins and things, is using the rife. So definitely you want to be utilizing the rife if you have parasites. Run some parasite programs. How do you know when they're gone? You just don't. I mean, you can run a lab for them, and that's probably the best way to know. But still, again, like I've said, with any other tests, you can get a lot of false positives and false negatives with tests too. So probably just better off continuing to do the right things and let nature take its course that way. My mom is suffering from an increasingly bad restless leg problem, preventing her from sleeping. Keeps her up. She gets up every hour to go to the bathroom, can't get back to sleep. It's very difficult. I do have an article on ferritin, iron, and cancer. So iron deficiency can be an issue with restless legs. You don't want to take iron if you have cancer, unless you definitely have low iron levels. So getting a blood test is the way to go. Iron can feed cancer, and that's not good. So if you're going to take iron because you have low hemoglobin and you have low iron, you really have anemia, which is very common with cancer, then you want to take something like artemisinin and or berberine with cancer, because they tend to follow iron, and then if the cancer is gobbling up the iron, then it'll have to gobble up the artemisinin and berberine as well, and that can help kill the cancer. So then you just use it to your advantage. But you do want to get a blood test before you take iron. Melatonin hasn't really helped. Melatonin will only help you fall asleep. It won't help you stay asleep. Remember, you could take higher doses of melatonin. There really isn't a high limit of melatonin to take, so I would try to increase that. Full spectrum CBD can be very helpful for relaxing. We have a CBD called CBD Pavate Sleep that has some nice other calming herbs in it too. We get a lot of feedback on that people really like that to help them calm down and sleep. One of the things that I've found with restless leg syndrome is if you can take a bath with Epsom salts and lavender. Epsom salts, use a cup of Epsom salts and use lavender essential oil, and maybe put 15 drops of lavender essential oil in your bathtub and just lay in the bath for 5 minutes if that's all you need. That can really help calm down restless legs. Restless leg syndrome can also be a mineral deficiency, not just iron, but it can be a magnesium deficiency, hence the benefit of using Epsom salts. But so think about using minerals, and minerals can be something that as we age, it's more difficult to absorb minerals. And so it's really important that we are looking at minerals. Also, with the heat, if you're out sweating at all, you're losing a lot of your electrolytes. So usually restless leg syndrome has to do with an electrolyte mineral deficiency of some kind. Is there a TrueRight program that helps? I haven't heard any good feedback of any TrueRight program that helps restless legs. It's really, you have to deal with that deficiency. Regarding my invasive bladder cancer, I'm running the TrueRight programs around 2 weeks ago, started and taking suggested supplements just a week ago. The discomfort is becoming unbearable. We've watched your video of good and bad pain and understand the pain may increase at the start of treatment. But what can be done for the constant horrible burning pain around my urethra and anal regions? So yeah, you want to always, when you have a symptom, you want to make sure you aren't just treating the symptom, that you're making sure that something else, you're trying to look for cause, right? So could the pain be because your body is killing the cancer? Yes, that's always a possibility. But then you'd have pain right at the cancer site, not somewhere else. So invasive bladder cancer, if you don't have if it's not spread to the urethra and you have urethral pain, I would say you do want to consider, is there a possible infection? So do you have some sort of UTI that you should treat differently with maybe some different supplements or even medication, making sure that you get that checked? Might want to do a UA with your local doctor and see if there is bacteria present that you need to treat, or a white blood cell elevated or something like that you want to look for. Look for the possible causes. And I know when we have cancer, we always think, well, it's the cancer. It's not always the cancer. It could be other comorbidities that are going on. We found several TrueRight programs for pain. Again, I wouldn't necessarily run the pain programs. I would think about UTI type programs or infection type programs, viral, bacterial type programs. That's what I would think of. Also, although I've never tried boswellia and white willow bark, has never touched my pain in the past. I'm already taking several that you mentioned in the pain control, like ginger, turmeric. Yeah, I would say that if you're taking ginger and curcumin and stuff and CBD and it's not touching the pain, you do, again, want to get to the root of the pain. And even taking like a pain medication, it makes the pain go away, but the pain is a signal of something. If the pain is just because your body's killing this cancer or because the cancer itself that you can't do anything about until your body starts killing it and decreasing the pain because of that, then by all means using a pain medication is the right thing to do because you don't want to have to just tolerate pain. But if your pain is caused from something else and you just take a pain medication, well, then you're just overriding your body's attempt to tell you that there's something wrong there. So do make sure that you get a diagnosis of what is the cause of that. Recently, I read that Dr. Flavin, who does integrative cancer protocols, she was interviewed on Nathan Crane's Missing Link Cancer series along with me, said that she only approves certain types of selenium supplements as some types can contribute to cancer growth. So yes, I think she actually got that information from me, but it's selenium methionine, which is a very good source of selenium, is a common source of selenium for patients with thyroid issues. But if your cancer is driven through methionine, then you don't want selenium methionine as a supplement. So there is liquid selenium that we use. There's other seleniums that are out there. The selenium amino acid chelate, I'm not sure what that is, but that is typically selenium. I'd have to look and see what amino acid it's chelated with. So that's the thing. You have to know if it's just selenium chelated with methionine. Methionine is amino acid. Then that's what you wouldn't want to use if your cancer is driven by methionine. Well, how do I know if my cancer is driven by methionine? Well, if we took you off of red meat, then you don't want to use selenium methionine, it's usually called. If, well, no, you didn't take me off red meat, then you're safe using it. So it's only people whose cancer is driven by methionine that you wouldn't want to use selenium methionine. That's the only note. Second note on this is that usually the dosage, how much methionine you're getting in a selenium methionine is so minuscule that it's really not an issue, to be honest with you. You're getting much more methionine in just plant proteins than you're getting in a daily dose of selenium methionine. So I just think this is really a non-issue. Okay, there's some questions. My plan calls for 2 capsules of phosphatidylcholine per day. I am already on the phase 2.5. 3 per day. My plan calls for 1,300 milligrams a day. The phase 2.5 is 900 milligrams a day. I would, if you want to just get off of the soy altogether, then I would do exactly what you're saying. Should I increase my intake of the 2.5 and then just phase out the phosphatidylcholine liquid capsules? Yes, that would be a good approach. I have found soaking my feet in an inch of magnesium oil, like Ancient Minerals brand. Yes, so there's a brand of mineral oil called Ancient Minerals. We used to sell it. We don't anymore, but you could look it up on Amazon or something like that. Soaking your feet for 10 minutes helps restless legs and ankle cramps. Magnesium supplements help some too, but you're getting the magnesium right too. And this is a good solution for people who there's no way I could get my mom in a bathtub. It's too dangerous for her by herself trying to get in and out of a bathtub, something like that. You can also do, the only thing I have against the mineral oil is that as it dries as a salt on your skin. Because magnesium, all your minerals have to be chelated to something. So it ends up becoming a magnesium salt as it dries on your skin, and it can be itchy. It's not a big negative. You just got to wash your feet after it dries if it's itchy for you. We used to use a lot of the magnesium oil because it is fairly well absorbed through the skin. But that was the complaint that we got. People would put it on their arms, and that's how they would apply it, or on their belly. But then they'd say, "Oh, I got this. My arm just itches like crazy." Well, just wash your arm. But it was just an issue that some people have. You can also do Epsom salt just in a foot bath too. You could just fill your bathtub and put your feet in the bathtub, sitting on the toilet if your toilet's right next to your bathtub, or sitting on a chair that you can set next to your bathtub. If you're by yourself and you don't want to get in and out of the tub by yourself. I started the Rife last week, but said sending my initial info to your clinic regarding my lung cancer. I was hospitalized with a lung infection. Oh, I'm sorry. After 22 days of antibiotics, I'm better, but there still seems to be some signs of infection. Should I add an additional Rife program to help? Yes, especially if you know if they cultured what that infection was. So let me explain. So if you're in the hospital with an infection, they said you have, strep infection because they cultured it, then run the strep program. So whatever they told you you have, if they gave you the specifics on it, if there's a specific program in the Rife, look for that. If there is, then run that. If the antibiotics helped with the infection, then it was most likely a bacterial infection. But after 22 days of antibiotics makes me think that it quite possibly could have been a viral infection, and the antibiotics were just killing any subsequent possible secondary bacterial infection. Because usually if you have a straight bacterial infection, you don't necessarily need 22 days of antibiotics, but it's possible because of the cancer. So that being said, there are specific programs for specific bacteria. If you can't find that specific bacteria that they told you listed, then run the bacteria programs. Also, there's a viral complex program, this is about 2.5 hours, but it's really good. So you might want to run that as well. Do those during the day. Some of the bacterial programs are shorter, maybe 30 minutes, but run them a couple times and cycle through some of the bacterial programs if you don't know the specific organisms that they said that you were causing your infection. So great thought process. And it brings up another point that you really want to use your Rife for your first go-to on all these things, especially any type of infection. Anything you can think of, use your Rife as the first go-to. You hear me say it over and over again that we've had so many testimonials about the Rife helping people with the absolutely craziest things. So use the Rife as your first choice of medicine cabinet, you could say. Like you go to your medicine cabinet to take something for this symptom you have, use your Rife for that, and let your family use your Rife when you're not using it for things that they're dealing with too. You can never hurt yourself with the Rife. So that's what it should be, the first go-to. Doesn't mean you wouldn't do other things too, but still, that should be your first go-to. Is there a program on the Rife for swollen lymph nodes under my chin? Oh, there's a program for swelling though. So also, remember we talked about last week about this, the swollen lymph nodes under your chin that probably coming from dental infection. So always think about, well, what caused that thing? So my symptom is pain, like we talked about in the question before. Well, do I just take something for pain? Well, you should first ask, what's my pain from? So just like if I have a toothache, do I just take a Tylenol and make my toothache go away, or do I have to go and fix what's causing my toothache? Well, of course you would, right? Same thing with anything though. Sometimes we get in the habit of just treating the symptom. We have to make sure we're always thinking about cause. So swollen lymph nodes, yeah, you could run the swelling program, but better maybe is, okay, why would there be swollen lymph nodes underneath my chin? Well, then it's like the lymph chain underneath my mandible is my submandibular lymph node chain, and that drains all my dental, all my sinuses, all my face, from my head. So could be an infection or inflammation from somewhere upstream. So then you think, okay, if it's an infection, remember that's the number one cause of swollen lymph nodes, then maybe it's a dental infection. So maybe I should run the dental infection programs. There's a whole bunch of dental programs that would be good to run. Maybe running the viral program again, like we said, maybe running some bacterial programs. If I were you with this, I'd run dental programs and maybe the viral program. You're very, very welcome. Any other questions? So remember the announcements. You can see them on your screen there, so I won't reread them, but are there any RIFE programs or helps for pain and swelling that happens in the process of, okay, so you're doing the black salve process. There's pain and swelling that can happen from that, right? So now you know the cause. So it's because the skin is stretching and you're cleaning it with hydrogen peroxide. So you really know there's no infection. So now, then I would just run the pain programs or the swelling programs. So exactly think through that process of how you would, you want to look for cause. Oh, this is the cause. I already know what that is, and I'm already treating that. Well, then now you could just treat the symptoms. Question, did I miss a question? Did my AFP question come through? Ooh. I didn't see that question if you asked that. Oh, I could look on the member site. Regarding earlier sugar post about monk fruit. So monk fruit is another commonly used sugar substitute, but I do believe monk fruit raises glucose levels. So it's a natural source of sugar, but it's not necessarily a substitute for, it doesn't decrease your, it doesn't not raise blood glucose levels. So yeah, you could use it, but you'd want to still be careful with the amount that you're using because it's raising blood glucose levels. Okay, I'm looking at our site right now. Oh, I did miss a question. Here's the question. I have 5 tumor marker tests done monthly, AFP and all the CA tests. The AFP is the only one that has ever been out of range, thank God. If I have breast cancer and AFP measures for ovarian liver cancer, is there any reason to think I have liver cancer or ovarian cancer? No. So the tumor markers are not exactly specific to a type of cancer. So AFP tends to be elevated more so with people with liver or ovarian cancer, but you could have stage 4 ovarian or liver cancer and you still have normal AFP levels. So none of this is a perfect science. So no, if you have a tumor marker test that's typically for something that other than you have, it does not suggest that you have another cancer. You'd certainly want to look at other signs and symptoms before you even come close to jumping. So that kind of thing. What's a high range number for breast cancer patients AFP result? That I don't know, and there's no data on that, I'm sure. So they just have a normal range that is given as the lab normal range. And so there isn't a high number for breast cancer with that one. So again, so your other cells give off these tumor marker enzymes, So that's why there's a range. So maybe the normal range for something is 0 to 35 and you're at 14, so you're within the normal range. Hey, well, you're still at 14 of the CA 15.3 or whatever. And what does that mean? Well, it means a person that doesn't have cancer still creates those enzymes. It's just that if a person has cancer, a cancer can create an excess amount of those enzymes, and therefore you can use it as a marker. That's why they're called tumor marker tests. But if you have your daughter who doesn't have cancer, go run those tests, they're not going to be zero. Their body normally makes some of those things normally. So the truth is the elevated AFP in your case may not even be due to the cancer. It just might be normal for you. So that's just the truth. So we just don't know. So that's where you say the tumor marker test can be a good indication of growth or regression, but they're again, like any test, certainly not perfect. Sorry, I missed your question. All right, well, we will say goodbye to everybody, and I will see you next week. Remember, no Zoom call next week, so don't forget, and then we'll see you the week after. But keep submitting your questions on the member site, and we'll get to those the week after. If you have any other needs, make sure you give us a call. All right, thanks so much. I'll be praying for all of you, and I appreciate your prayers for us too. Bye-bye, everybody.